Alright, so, grüß Gott, meine sehr verehrte Damen und Herren. This is our typical Bavarian greeting, and with that, we are starting the DigiHealth Day 2022, the third edition of our International Symposium at Deggendorf Institute of Technology, European Campus Rottal-Inn. I'm Georgi Chaltikyan, your host, professor and head of digital health at DIT-ECRI, and it is an absolute pleasure to welcome everybody to this room, both on-site and online. It is 8:30 a.m. here in Pfarrkirchen, Bavaria, Germany, on a beautiful date, 11/11/22. And I'm very pleased that we are having a full house, basically, here on site for the first time ever. And we're also hundreds of participants joining us online. Before we invite our dignitaries to officially open the day, I would just like to say a few welcome and appreciation words. And first and foremost, to all our participants, to all attendees from around the world, joining us both on-site and online, and of course also our students, young, bright, motivated professionals for whom we essentially work and live. All of this would have not been possible without our brilliant speakers, also joining us both on-site and online, literally not just from different nations, but from different continents. And great thank you, and my words of appreciation to all our speakers who have made this possible. I would like to perhaps specifically mention our colleagues from Ukraine joining us today on site, who have made all the way from Kiev to Pfarrkirchen to be here with us. And I hope I need not say about the challenges that the trip was associated with, given the circumstances. Thank you very much, dear colleagues, for being with us here. And I would like to use this occasion to reiterate our strongest commitment to the peaceful development of humankind, and perhaps to suggest a brief moment of silence in honor of all who lost their lives in military conflicts around the world. Thank you very much. Ladies and gentlemen, we are honored to enjoy support by our governmental bodies and authorities, the Bavarian State Ministry of Health and Care, the district administration of Rottal-Inn, and the municipality of Pfarrkirchen. Thank you very much for your valued support. Much of this would have not been possible without our sponsors. And we are honored to present the premier sponsor of this year's series, SRL Telemedicine. Later this afternoon, you're going to hear from one of the leaders of the company. We're also thankful to our sponsor, ITD or ITD GmbH, who are present here on site today with a dedicated stand. So take a moment to stop by and to exchange a few words with them. We would like to, of course, mention all our partners and supporters from all over the world, including the global units, global entities such as the HIMSS, Healthcare Information and Management System Society, the ISFTH, International Society for Telemedicine and eHealth, the EMEA, International Medical Informatics Association, the AFME, European Federation for Medical Informatics, which is hosting a special session later this morning. It is probably worth mentioning that the European campus of Deggendorf Institute of Technology is a proud institutional member of all these international societies and a partner. We're also partnering with German Society for Digital Medicine, DGDM, with German Telemedicine Society, DGTelemed, with Bavarian Telemedicine Alliance, and with Armenian Association of Digital Health. We thank all our partners. Special thank to our media partner, DigitalHealthNews.eu, a portal. Thanks to our publication partners, the Journal of Applied Interdisciplinary Research, right here at Deggendorf Institute of Technology, and the Ukrainian Journal of Medical Informatics and Engineering. We thank our academia partners, the Ukrainian National Healthcare University that we mentioned earlier, the colleagues representing it here on site, the Russian People's Friendship University in Moscow, and the Russian-Armenian University in Yerevan. And last but not least, we're also happy to be a partner event with the Munich Digital Health Summit taking place these days, also today, this morning, in our Landeshauptstadt, in the capital of Bavaria. And we are happy to have many participants of the Digital Health Summit in Munich, joining the DigiHealth Day in Pfarrkirchen, and vice versa. A few organizational things that I would like to mention, ladies and gentlemen, before we proceed further. So just a reminder that we will be in this room for the entire plenary track of this day, from the morning till the evening for plenary sessions, for panel discussion, and also for the FME session later this morning. Scientific session and student session will be run parallel to the FME session at different rooms, both on-site and online. We're going to be wrapping up at approximately 6 p.m. and starting at 7 p.m. Everybody is welcome and invited to join us for the DigiHealth evening reception at beautiful Spitalkirche, right here in the heart of Pfarrkirchen. On that, ladies and gentlemen, without further delay, I would like to invite for an opening address the Bavarian State Minister for Health and Care, Honorable Klaus Holecek. Let's take a listen.
Ein herzliches Grüß Gott, meine sehr geehrten Damen und Herren. Ich freue mich, dass das Thema Digital Health international auf so großes Interesse stößt und Sie alle heute nach Niederbayern gekommen sind. Denn ich bin überzeugt, Digital Health ist die Zukunft der Medizin und des Gesundheitswesens. Auf den ersten Blick hat das Thema vor allem einen technischen Charakter. Und es stimmt, ohne die Technik kommen wir nicht voran. Aber für mich geht das Thema noch viel weiter. Es geht darum, Wege zu finden, wie wir auch in Zukunft eine hochwertige medizinische und pflegerische Versorgung sicherstellen können. Es geht letztendlich um das Wohl der Gesellschaft. Der demografische Wandel zwingt uns, neue Wege zu gehen. Digitale Lösungen werden dabei eine zentrale Rolle spielen. Ein wichtiges Thema auf Bundesebene ist in diesem Zusammenhang das geplante Gesundheitsdatennutzungsgesetz. Es sollte meiner Meinung nach möglichst rasch kommen. Die Handlungsfelder reichen weit. Es geht zum Beispiel um die Regelung bei der EPA, um die Erweiterung des zugriffsberechtigten Nutzerkreises für das Forschungsdatenzentrum oder um eine intensive kommunikative Begleitung der Digitalisierung im deutschen Gesundheitswesen. Auch auf EU-Ebene ist der Zeitpunkt günstig. Im Rahmen eines europäischen Gesundheitsdatenraumes muss jetzt die Nutzung von Gesundheitsdaten für die Versorgung, Forschung und Innovation EU-weit unter gleichen Standards möglich werden. Dafür hat sich der Freistaat auch im Bundesrat stark gemacht. Und auch innerhalb Bayerns setzen wir wichtige Akzente. Die Staatsregierung investiert im Rahmen des Masterplans Bayern Digital rund 6 Milliarden Euro auch in Gesundheit und Pflege. In diesem Rahmen ist zum Beispiel die Projektreihe Dein Haus 4.0 entstanden. Eines dieser Häuser wird aktuell an der TH Deggendorf umgesetzt. Es geht dabei um intelligente Assistenztechnik für Pflegebedürftige und wie wir sie für Menschen überall im Land dann auch erlebbar machen können. Dein Haus 4.0 und der DigiHealthDay zeigen eindrucksvoll, die TH Deggendorf ist in Bayern ein Motor der Digitalisierung und strahlt damit weit über den Freistaat hinaus. Ich wünsche Ihnen eine interessante Veranstaltung und vor allem viele neue Erkenntnisse und Ideen zum Mit nach Hause nehmen.
Dear Georgi, dear ladies and gentlemen, it's a great honor for me being here, being a part of this opening ceremony of the Digital Health Day. And it's just in time to talk in a Bavarian tradition. I only have 2.5 hours now being mayor, then it's finished. Because it's a Bavarian tradition, the 11th of November, at 11 o'clock, 11 minutes, the Carnival Association will visit me in the town hall in my office, and then I have to give them the keys of the town hall. So only 2.5 hours, Mayor, Mr. Beismann, and then I go in holidays and see you at the end of February. But now we are here, and it's good to be here. I'm very proud to talk for the city of Pfarrkirchen. That Pfarrkirchen is one more time hosting the Digital Health Day. Digital health, Mr. Holecek announced it, is a very important part now and especially in the future in our healthcare system, because I think we have to do these connections. We have to create direct ways between centers of excellence. We have to use all the resources of a lot of clinics to connect them, maybe to improve the connections in-house in a clinic. And so this will help the patients. And we have to take care for humans. We have to take care for the patients. And you are an important, very important part to create new healthcare systems, to improve healthcare systems, to do it in a better ways, to create synergies. And I think bringing people together, like now from all over Europe, from all over the world, we can learn each from another, best from the best, to do best practice. And it's a very, very good way. I think it's a great motivating thing for our people being here. And it's a sign for the very good work you do here at the European campus, Rottal-Inn. And for Pfarrkirchen, it's a very great thing, and and it's also very good for the development of the campus. I try to do it in English because it's an international session. I hope you could understand me. If not, please excuse me. And now I leave to search the key of my tunnel. Thank you. Have a nice day.
So thank you very much, Mr. Beismann. Thank you once again for your support of all our endeavors, for the support of this institution, of this campus. Of course, without the super welcoming atmosphere and attitude and commitment by local authorities, as well as by regional authorities, we would have not been able to achieve all that. Ladies and gentlemen, I'm also pleased to welcome all of you on site and online on behalf of my dear colleagues at the Deggendorf Institute of Technology, European Campus Rottal-Inn. I have to say that we are enjoying also full support by the leadership of the university. So we are giving a warm welcome on behalf of the president of the Deggendorf Institute of Technology, Professor Peter Sperber. We have today on site with us the vice president of the Deggendorf Institute of Technology and the founder and director of European Campus Rottal-Inn, our dear colleague, Professor Horst Kuhnert, who is going to address you with few words in just 2 minutes. Of course, a warm welcome also on behalf of the Dean of Faculty, Professor Christian Steckenbauer, on behalf of all our colleagues, professors, researchers, on behalf of the DigiHealthDay Dream Team, on behalf of our beautiful staff, and of course, on behalf of our super fantastic student volunteers. Thank you all very much for making this event possible. Later today and in the evening, we will have an opportunity to name and honor each and every one of you individually. Thank you very much. And now let me invite Professor Horst Kuhnert, the Vice President of DIT, Director of ECRI, for his welcoming and opening address.
Yeah, good morning, everybody. And it's a great honor and pleasure to see you here in presence and from a lot of countries, from the Ukraine, from India, from Canada. It's a really great honor that you made the way here to Bavaria, to Pfarrkirchen, to be with us with this very interesting conference, DigiHealthDay, version number 3, I would say. Thank you very much to the maker of ideas and the maker of the conference, my dear colleague, Professor Georgi Kaltikian, and his team, who made it possible to have this virtual, this hybrid meeting and this online meeting on a very interesting topic. And it's really a great honor that we have welcome addresses from our State Minister of Health, Minister Klaus Holicek, and the ministry is represented. And in the afternoon session, the ministry takes presence with a contribution and with some presentations. So the minister addressed the master plan Bayern Digital 2, and it's really a big investment in the future of our healthcare provision. And a very major part of that is digital technology, is IT. And I think I spent the most of my life in this world as the CIO of a hospital and so on, and as a teacher in this field. And therefore, it's very important that we address it in our lectures. in the master program, Digital Health, in the bachelor programs, Health Information, in various other study programs that we have here at the Deggendorf Institute of Technology. And it's a really good sign to the world that we work together here from the regional level, from the city, from the mayor to the region. I'm sorry that I must apologize our Landrat Michael Fahrmüller. He is ill, but I should send you his best greetings and success for this conference, and not only to the regional level, to the state level, and to the international level. And therefore, it's really a big pleasure for me, a great pleasure for me that you made it from the Ukraine here, from Kiev, and we all know the situation, and everybody would like to end this situation and to look in a better future, and therefore change is something that is always in our life, and we all look in a better future from now on. And maybe the European campus Rottal-Inn here at Pfarrkirchen of our Deggendorf Institute of Technology can be something like a role model. We have roughly 1,500 students out of 80 nations, and we work together, we live together, we study together, and that could be a role model of our future. And this is my wish for the next future and for this conference, that we exchange locally, we exchange over the internet, and therefore I wish good success and fruitful discussions here at our site in Pfarrkirchen for the DigiHealth Day. Thank you very much.
Thank you very much, Professor Kuhnhardt, our scientific chair of the DigiHealth Day conference series. Now, ladies and gentlemen, it is my great pleasure to invite our colleagues who are joining remotely for also welcoming and opening addresses. It's a great pleasure to have with us Deepak Kalra, Professor of Health Informatics of University College London, one of the prominent scientists, scholars, academics, teachers, and innovators in digital health. We've been absolutely blessed, I should say, and honored to have had Deepak as our longtime colleague, supporter of our teaching endeavors here at European Campus, supporter of our study program, and the honorable international chair of the DigiHealth Day series. We are going to hear the welcoming address by Professor Kalra. Deepak, the floor is yours, and thank you very much indeed.
Well, good morning, Professor Chaltikian, dear Georgi. Thank you so much for inviting me again to be part of this fantastic event, and also inviting me to track other activities you do through the year. This event is phenomenal. Previous years have already been phenomenal, but I think this year you really have surpassed all expectation with a fantastic on-site as well as online audience. And I am really sorry not to be joining you on this occasion for a personal health issue that is short-term. And next year I will for sure be with you side by side, enjoying the Bavarian hospitality that you hinted at earlier today. This program is reflective of, I think, a really important evolution regarding digital health, the role of health ICT innovations. Health systems are really struggling as a result of the COVID-19 pandemic, which has stretched their resources and capacities, exhausted health professionals and health systems, exhausted the budgets too. And so we are at a point where, in order to continue to do business as usual, but also in order to be more resilient to any future such catastrophes, health systems have to be more resilient. Health systems have to be more efficient, they have to be more effective, and they have to be much more strongly partnering patients as caregivers of themselves, as co-contributors of their own health. And we have to leverage innovations such as artificial intelligence that can help us to do that more smartly and more safely. And when I was looking, as I have done every few days, at the program, I am more and more impressed with the topics and the speakers that you have throughout the day that are really capturing exactly this high priority agenda for healthcare. The days of playing with technology are over. We are really at making health ICT innovations deliver to really immediate and urgent benefit to health systems, to patients, clinicians, and the whole health and care ecosystem. And this program is absolutely action-packed with illustrations, examples, and thought leaders. So the keynote talks that you have throughout the day are all touching on different aspects of this, including not only what can the innovations do, but how can health systems absorb these innovations and make good use of them and transform themselves. And then you have a set of parallel scientific sessions that are really on the hottest, most important topics. So whilst we could look upon this as a scientific program, this is really an agenda for transformation of health systems, an agenda for the survival of health systems. And so this conference is so critical, so important. And Georgi, my real congratulations for you to action pack this program with so many relevant high profile talks. I'm really looking forward to the day, and thank you for involving me in your fantastic ideas, inspiration, and vision.
Thank you very much, dear Deepak. Thank you for your continued support. Thank you for your words. And thank you for being with us today and before, and hopefully in the future. And we look forward to having you joining us in person, on site, next year. Thank you very much. Ladies and gentlemen, it is our great pleasure to have also opening words and welcome address by representation of the World Health Organization. As we all know, the World Health Organization has dedicated and is continuously dedicated very significant efforts to promote developments and strategic developments in digital health around the world. We are honored to have had some collaboration opportunities with the WHO Europe office, the regional office, a European regional office in Copenhagen, and we're pleased to have today the technical officer and the leader of one of the leads of the digital health at WHO European office, Dr. Ryan Dos Santos, who will be giving us now his opening address. And later this afternoon, as you probably know, he's also giving us a keynote on the most recent developments and advances that the WHO Europe office has with regard to digital health. Dear Ryan, thank you very much for joining us. Thank you for your support. Thank you to all our colleagues, your colleagues at WHO Euro office, and the floor is yours, please.
Hi, good morning all. Good morning, speakers, invitees, students, attendees, or dignitaries, and Dr. Chaltikan. Good morning. Always a pleasure to be working with you. And I am really thankful for, happy to be for the invitation to this. And it's great to be here this morning. I just want to leave you with some words of welcome and also some thoughts to put in your head and to keep at the forefront as we go along during the course of this day in all the important topics that are being discussed. The digital transformation of health systems and data, as we all know here, is recognized as a key component for achieving better health and well-being and for working towards universal health coverage in the WHO European region. And the COVID pandemic has greatly accelerated the impetus for digital solutions, as we've all seen. And this impetus has essentially forced a shift in focus to new models of care, supported by digital technologies across the entire region and globally. And we've seen digital tools rapidly employed across a wide range of contexts, from surveillance, diagnostics, diagnosis and self-management, to reorganized care delivery, areas such as telemedicine and telehealth services, and strengthening search capacities and dissemination of vital public health information. Beyond the pandemic context, however, the potential for digital health is being well recognized by decision makers that it's key in enhancing efficiency and sustainability health systems, in delivering quality, affordable, and equitable primary health care, strengthening health promotion and disease prevention, and facilitating people-centered integrated care management, which is key, rehabilitation and palliative care. It's also been recognized that appropriately used people-centered digital solutions has the potential to enable countries to make substantial contributions in advancing universal health coverage, in protecting the public in emergencies, and overall health and well-being. However, there are key aspects that we need to be very cognizant of. And we need to ensure that investments in digital transformation are applied appropriately to solving the most pressing and intractable health systems and public health challenges. And we need to ensure that digital solutions do not increase existing gender and health inequalities and inequity, and leading to increased marginalization of vulnerable populations. So in all that we're doing, we need to be cognizant of these. And it should also be noted that it's not about the technology alone. The technology exists all over, but there are also underlying factors that we have to be very cognizant of. And continued and sustainable uptake of digital technology is dependent on these underlying factors. There's a need for strong political commitment, ownership, and alignment of all stakeholders to leverage digital transformation. And this includes the enhancement and development of national digital health strategies and related governance frameworks that need to be put in place, as mentioned, from a multi-stakeholder approach. All need to be involved, from the patients, the providers, decision makers, those learning, and so on. They all need to be part and parcel of development of the digital transformation. And there's also a need to ensure proper privacy, security, and ethical use of data and protection of the fundamental rights. And this is to ensure public trust and empowerment of the public in digital use of digital technologies. If the public don't trust the technology, they won't use it. And we need to ensure that that trust is there. And we need to strengthen health information systems and health data governance and use to ensure that we don't just collect a lot of data, but we also use this data for research, analysis, and decision-making. And also, there's strong need for digital literacy skills and capacity building in the general population, as well as the health workforce, for digital health services, disease prevention, and management. And we need to ensure that the digital skills are institutionalized. It becomes part of all the training and the teaching and the knowledge generation that is done. Overall, I just want to share that it should be understood at a fundamental level, digital health is health. It is not just an add-on, it is actually part and parcel of health systems. And it involves all of us as patients, as providers, as public health professionals. I look forward to sharing more information on our presentation later on the day on what the WHO Regional Office for Europe seeks to do and what they're doing to ensure appropriate and sustainable adoption of digital health solutions across the WHO European region. It's a privilege to welcome you all here today, and I'm looking forward to all the discussions and all the very important topical areas that I see on the agenda. And I hope you find the participation fruitful as we all work towards the digital transformation of healthcare. And as being said by the Digital Health Day, global digital health today, tomorrow, and beyond. Thank you all.
Thank you very much. Thank you very much, Ryan, for your thoughtful welcoming comments. And now, ladies and gentlemen, it is my great pleasure to invite for opening remarks our longtime colleague, our friend, I should say, our partner, the executive president of the International Society for Telemedicine and eHealth, Professor Yunkap Kwangkam. We have also enjoyed a long-standing relationship with the ISFTH. I mentioned earlier this morning that the European campus Rottal-Inn of Deggendorf Institute of Technology is a proud institutional member to the ISFTH and also the co-founder of CONDIG, the Consortium of educational institutions in digital health. So Yunkap, thank you very much for the continuous support, and please, the floor is yours. Thank you.
Thank you very much, Yogi. My name is Yunkap Kwangkam, and I represent the International Society for Telemedicine and eHealth. It's indeed a pleasure for me to be here today. So good morning, good afternoon, good evening to all of you, depending on where you are on the globe. It's really quite moving to see how far DigiHealth Day has come. This forum for sharing and exchange of thoughts, insights, experiences on digital health has become a fixture on the annual digital health calendar. Now, at the ISFTEH, our mission is to facilitate the international dissemination of knowledge and experience in telemedicine and eHealth, and to provide access to recognized experts in the field worldwide. So we are very proud to continue to partner with this event, whose proceedings will provide valuable input to the Society's journal to ensure wide dissemination of the lessons which are going to be shared here today. And in that vein, I'm happy to note the ongoing engagement of CONADIG in this process. CONADIG, as you would recall, is a key element of our education program. So the ISFTEH extends to all of you significant opportunities to collaborate with global players in the digital health space through membership, whether it be individual, through organizations or institutions, and to engage in our various working groups and committees. At last year's DigiHealth Day event, I argued that the key challenge we face in the digital health space is that of converting our collective knowledge into a global public good that is accessible to all, to enable each digital health actor to benefit from what others know. And I made a plea for the creation of technology pull forces in countries, and in particular with the creation or strengthening of a global knowledge commons to promote sharing of information and knowledge. That dream remains a dream, even though it's being realized in bits and pieces in many parts of the world, but the effort still remains uncoordinated. So I'm going to be very brief. I'll reiterate my call for the development of a global knowledge commons. And so on behalf of the International Society for Telemedicine and eHealth, I wish you all a very successful event and invite you to join us in realizing the global knowledge commons for digital health. Thank you for your attention.